Ready? Really? It is a Thursday. We head on down to Wyoming Liberty Group, and Charlie's hanging on the phone, who's the new guy with Wyoming Liberty Group. And Charlie, I'm afraid to pronounce your last name. How do you pronounce it?
Katibi.
Katibi. Boy, I'm glad I asked. So as the new guy down there with Wyoming Liberty Group, Maureen sent me a really interesting article that you wrote. And is it right you're focusing on healthcare?
Primarily. That is
Primarily.
correct.
Okay.
Yeah.
And as I can't wait till we get into some, because our governor here in the state of Wyoming disagrees, but wants to expand Medicaid and so on. Boy, glad that sucker was shot down this time. But of course, it's like a horror movie, Charlie. It's going to keep rising back up again. We're going to have to keep stabbing it down. But your article that you wrote for Wyoming Liberty Group has to do with Obamacare. And you said insurance regulations, individual mandate, and insurance subsidies. There are three, pillars, if you will, or bulwarks of Obamacare. What do you mean by that?
What I mean is that the law was designed very specifically with those three structures or foundations in mind. And if just one of them went away, then the entire insurance market can break down. And this is essentially what King v. Burwell is about. It's about whether or not the subsidies can be offered to people on the federal exchanges, but that, as I'll explain, this has very far-reaching consequences for the rest of the law.
And for those who don't know, this is, of course, the Supreme. If you don't know, I'd like to see. I ask people often, Charlie, to send me a photograph with their address or just their address so I can look up on Google Earth and see the rock that they're living under. It would be the Supreme Court case right now going on. And this whole thing goes around the mandate. Now, I've had a little bit of trouble understanding it as well. Why can't some states receive subsidies and another can't?
Well, the reason why is because in the law as it was established, states had a choice over whether or not they could set up an exchange or not. This was left up to them for them to build it, and the federal government would provide all the costs up to 2019, I believe.
Right.
And if they did not decide to, then the federal government would. They would come in, they would build the exchange. Now, what it's over is whether the people on the federal exchanges are also eligible for subsidies to subsidize the cost of their insurance, as well as the state exchanges.
Okay, now let's back up just a bit, because there's something that I had a good time. I mean, as a radio host, had a really good time with Jonathan Gruber. According to the way he set it up, all of the states had to get involved. If not, and set up their own exchanges. If not, then there wasn't going to be enough money to do this. But since all of the states weren't going to go along with it, and the feds were going to have to pick up the slack, wasn't it doomed to fall apart in the beginning anyway?
There is a lot of discussion about what the intentions of the crafters of the law were when they were building it. There was a lot of questions over what Gruber actually meant, because he has actually gone back and forth on whether or not they meant to set up the subsidies for the exchange.
Right. Okay.
Yeah. So, as it stands now, the law essentially is over a man named David King. Now, he is saying that he should not be eligible, he should not be forced to purchase insurance because his income is below the minimum threshold, about 8%. If the cost of insurance exceeds 8% of your annual income, you do not have to buy it. Unfortunately, with the subsidies, the subsidies are taken into account.
Right.
So if you get subsidies, you have to. But let me backtrack a little bit and explain just basically the structure of the law and just how this all fits in.
Okay.
The law's insurance regulations prohibit insurance companies from charging individuals of the same age different premiums. So if you or I, let's just say, are the same age, but I have cancer, we must be charged the same premium, regardless of whether or not I'm going to impose a lot more costs on the insurance company than you are. Now, if you're an insurance company and you must charge the same rate to everyone, you're going to raise everyone's premiums to pay for my cost.
You have to in order to stay in business. There's no way.
Absolutely. And also remember, there's another law, regulation in the law that prohibits insurance companies from turning people away based on their health statuses. So they can't turn me away just because I have a bad health condition. Now, if people could enter and exit the insurance market as they wished, younger and healthier people wouldn't even come close to this sort of insurance market because they'd be paying for someone else's care.
Right.
Now, this would lead to premiums becoming more expensive because only the sick would be left, and a small number of people would have to share in that cost. However, the second part of the Affordable Care Act is the insurance mandate. People are penalized in the tax code if they go uninsured.
Well, and let me back here for just a minute there, because and I don't want to get too far off in the weeds, but it sounds to me like we just changed the nature of insurance companies. Because before, insurance companies played a game of risk. They insured everybody like a casino, knowing that only a handful of those people would actually need insurance, and they were pretty much only insuring catastrophic things. But under Obamacare, everybody has insurance for every little thing that they would go to a doctor for, including just to get eyeglasses. They would use their insurance for it, or contraceptives. You're no longer a risk insurance company. Now you're a healthcare provider.
Well, to be fair, this has been around for several decades.
Yeah.
Obamacare did add 10, they will refer to it as minimum coverage benefits that insurance companies have to. But on the state level, across the country, there are 2,100 benefit mandates. Wyoming has 34 of their own, and there's been estimates that raises the cost of insurance in the state by 30% to 50%.
Okay. See, I never did that. I only insured things that were catastrophic and nothing else. If I had to go to the dentist or get eyeglasses, or if I had one time I woke up with an ear infection and I couldn't hear out of one of my ears, and I just paid cash out of pocket for everything, because it's insane, as far as I'm concerned, to get insurance to cover every little thing. That's as far as it'd be like filling up your car with gasoline insurance.
Absolutely. Yeah, it makes absolutely no sense. This isn't how fire insurance works.
Right.
This isn't how life insurance works or auto insurance. It's just health insurance, where all of these mandates have been forced onto insurance companies, and they pass on those costs to consumers, and which is why health insurance is so expensive now, even before the Affordable Care Act.
All right, now let me lead you into the mandate part here, because this is what really irritated me. See, I was under the impression, Charlie, that I was a free man in a free country. And one day, the government came along and canceled my insurance, and I did not give them permission to cancel contracts that I had signed in good faith with a company that had been treating me in good faith. And then they ordered me to buy a bunch of stuff that I didn't want. And if I didn't do it, then they were going to fine me or tax me or mandate me, and they can't make up their mind, whichever passes the Supreme Court. But don't worry, the Supreme Court will fix it if it doesn't pass. So you can tell, Charlie, I'm a little irritated here.
So I understand.
About this mandate thing you wrote about.
Yes. All right. So they were fully aware that all these benefits and mandates would raise the cost of insurance. And if it was up to the young and healthy, they would not enter into these agreements where they would pay where their premiums would just go to paying for the cost of care of others. But the mandate short circuits that death spiral, if you will. Everyone has to buy in to this expensive plan and program. But the thing is that they knew that it would be this expensive. So what they did is they added the third and final foundation of the law, which provides subsidies, which are means tested based on your income for individuals between 100% and 400% of the federal poverty line. Now the question back to the Supreme Court case is, who exactly is entitled to these subsidies? Now, the federal government has argued that these are available to anyone that seeks insurance on any exchange established by the state or the federal government, and has introduced and enforced those laws accordingly. The problem with this interpretation is that, as both of us know, as Obamacare was written, only those that purchase insurance on exchanges established by a state are eligible for these subsidies. And if the Supreme Court were to rule in favor of the plaintiffs, David King and three others, challenging the subsidies, a few things would happen. Now, the first is that the people on the federal exchange, after a few months, depending on what the Supreme Court decides, would lose their insurance. and maybe even have to pay them in back taxes. Now, this is around 7.5 million individuals that have accessed insurance on the federal exchanges. In Wyoming, 91% of the people that are on the federal exchange that enrolled were eligible for subsidies. And a victory for the plaintiffs could quadruple the cost of insurance that these people are paying. It's estimated that the average monthly premium people are paying right now in Wyoming on a federal exchange is $135. If the subsidies were to go away, they would have to pay for the full cost of all those mandates we've been discussing earlier, which would make their premiums $558 per month. And without the subsidies, the individual mandate becomes a lot harder to enforce. Like I said before, if your income is 8%, if the cost of insurance exceeds 8% of your minimum income, you are exempt from the individual mandate. With the subsidies are in place, only 3% of the uninsured could use that exemption. If the subsidies went away, 83% of the uninsured could skirt insurance, which is what they did prior to the individual mandate. So a lot less people actually wouldn't have to get insurance.
So the whole thing right there, again, just falls apart. There's no way the system could maintain itself. Yeah.
Like I said before, if the insurance market becomes voluntary, which it would look like, if the subsidies went away, 83%, tens of millions of the uninsured, wouldn't have to get insurance. And they will have, the young and healthy, the ones that didn't get insurance because it was too unaffordable, they have no reason to purchase this expensive mandated insurance.
Well, and wasn't this whole thing on the backs of the young? They were counting on the idea that young people would support the older people. Basically, it was a redistribution of wealth from the young to the old, which my theory was that's why people, they could stay on their parents' insurance until they're like 26 years old or something like that. And that's because they couldn't afford it at that age, but mom and dad could.
Of course, yes, that's the reason. And if they don't have to, and if they are exempt, they will not purchase this insurance. And remember, the Affordable and the Affordable Care Act isn't exactly true. The costs are just shifted onto the young. And if the young start to exit the insurance market, as people are predicting, the costs will continue to rise on a smaller and smaller number of the insured, which are the sicker and the older, like we discussed.
I really worry about the outcome of this, and I know you can't really predict. Neither of us are sitting in the courtroom. We don't know what the justices are thinking. But to me, the last decision they made on the individual mandate, I can't believe that they were allowed to get away with that. I mean, you can't have a mandate, so we'll call it a tax, which is essentially the same thing.
Yes. The federal government cannot force you to engage in commerce, I believe, cannot force you to engage in commerce, which is the way conservatives mentioned it, but they can impose a tax.
Which is the same thing.
This is true.
Okay.
This is technically true.
Yeah, and this is why I look at it and think, how did they get away with that? So can you imagine a way, because I can't imagine a way that they could find, to put it simply, in favor of Obamacare in this case either. But can you imagine a way that they would?
The way the liberal justices on the court were making the case were that if they were to rule that the subsidies on the federal exchanges did not comply with the letter of the law, then it would mean that, well, basically the way that they phrased it is that if they did it that way, it would not comply with the nature and the spirit of the law, which was to provide insurance to everyone. And if they cut off subsidies to millions of people in 36 states, it wouldn't really jive with the purpose of the law, which was to bring insurance bring assurance to millions and make it affordable.
See, I can tell you, you have to struggle to think like a liberal, and I know that's very difficult to do. So I appreciate what you just went through there. If you need
I'm trying my best. I'm trying,
Yeah, if you need a moment there to down some like Pepto-Bismol or some aspirin, I completely understand. Okay, so our own governor, just between you and me here, not like there's anybody listening, I wish we had elected a conservative governor. The last op-ed I wrote for the Campbell County Observer picked on Governor Meade for this very idea. He says he's not in favor of Obamacare, but he doesn't want the court to find against it because all of a sudden the states would be stuck holding the bag for a lot of money. And how would the states possibly be able to deal with that? My answer would be, well, just fold Obamacare and get back to the free market. I'm surprised he didn't see that.
Yeah, are you referring to Medicaid expansion?
Well, no. In fact, he said that about Obamacare. It was in the Wyoming. It was in Wyoming Tribune Eagle had a story about that.
Yes. What he is concerned about, and I've been going over his public comments on this. What it sounds like is he is concerned if the subsidies were to be turned off immediately, because for millions of people, this was the expectation that they were been relied upon by the law and everything that they've heard. And if they were immediately to be shut off, then that would be very concerning. However, there is no reason to believe that even if the Supreme Court did come down against the subsidies, there is no way that they would just immediately turn them off or order the IRS to stop sending them out.
Right. That's a whole nother process then. All right. Thanks for coming on. It's a good chance to talk to you. Your first week on the job, I guess. Where do people find that article that you wrote?
They can find that at wyomingliberty.org.
All right. Pleasure talking with you.
Nice talking with you.